Hi, Dr. Hobie Fuerstman with Preventive Medicine, here today to talk to you about ketamine therapy. This is a relatively new treatment to treat a variety of things, but first and foremost, it's really used in this clinic to treat chronic treatment-resistant depression. This is, again, a very large term that encompasses things that many of us have experienced in our life, myself included, where no matter what we seem to do, no matter what we try, our mood just can't really get lifted. It's hard to beat the depression, the sadness, the anxiety, and how that impacts the rest of our lives can really weigh quite heavily. First-line treatments like talk therapy, exercise, dietary changes, working on sort of those routine things, and beyond that, when you come to see a doctor, often those first-line medications just don't cut it for everybody, unfortunately. If they did, I wouldn't be here talking to you today. So when we look at kind of the next stage here, we look at sort of deeper ways to really change the way your brain chemistry works, change the way you think about things. And currently, the most effective and legal way that we have to really work with these deeper seated issues is something called ketamine. Ketamine is an anesthetic agent used to put people to sleep, either for surgery or for emergency procedures, that at a much lower dose produces a sort of out-of-body type experience, sort of an altered state of consciousness. Now, some people enjoy being in a state like this, others don't, but the truth is that state is only the beginning of things that allow you to gain perspective on your life. After the medicine works its way through your system, your brain chemistry actually begins to change on its own. You get an increase in natural levels of serotonin and an increased blood flow to the brain. And ultimately what this results in something is called increased neuroplasticity. That's a fancy word for the ability to make your brain change. So I often refer to it as opening the door to possibility. You still have to walk through it, but your brain is now open to new ways of thinking, new ways of patterning around old habits. Typically, ketamine can be given in several different forms. Most typically, we'll give it IV in the office, so intravenously in a solution. That kind of gives you a shorter and more intense experience that allows this process to really jumpstart right away. Beyond that, it's really important that you create a positive experience and environment, something that normally would make you feel good, but after a ketamine experience can really further these positive changes in your life and really help you create the mind and way of seeing and working with the world. Ultimately, your mindset determines so much of how you experience life. Similarly to that, your experience of pain can also be altered by ketamine. Your experiences of migraines, of other neurologic conditions, anything that the brain is really tied into can really be changed through these types of therapies. We know how powerful the mind is in our experience of life. And that's really what we're trying to work towards here, is creating a better relationship to your mind, to your body, to your life, to your really experience of the world on the whole. So this treatment is not for everybody, but it is something that makes a lot of sense for a lot of people.